And we're going to start.
Okay.
Well, good morning or good afternoon, wherever anybody is that's going to be listening or watching this particular podcast. This is podcast number 418, and I have the pleasure of talking with Jeff Roberts, the CEO of Capstone Health Network. And one of the things we're going to talk about today is relative to the Academy. We're launching a partnership with Jeff and his company and his organization. So I thought it was really important to just spend this time talking and kind of sharing some insight into what he sees as going on in the healthcare world and talk a little bit about the specific benefits that this is going to lend our members and associates and families. So with no further ado, I'll just get into it, Jeff, and we'll just start off with a brief introduction. If you can give me just a little bit of background, give our members a little bit of background about you and how you got into this particular world of work.
Well, Mark, thanks so much for making the time. Very excited to have this conversation, and in particular, working with the organization. I respect greatly what you do, and my staff and I are thrilled to be a part of doing something to be of assistance. My background is that I'm a longtime entrepreneur. About 2.5 years ago, we made the decision to try to do something to fix some of the challenges with healthcare in the United States. Washington loves to fight and chat about these kind of things, but there are real problems out there. 28.5 million Americans have no health insurance whatsoever. There are tens of millions of people, perhaps some of the members of your organization, that yes, they have health care, but the deductible is so high, often $5,000, $10,000, that by and large, the member is not getting much benefit from having insurance because it's very, very rare for people to actually hit their deductible. So there's a challenge with high deductibles. There's a challenge with copays. There's a challenge in some communities with affordability. Sorry about that, Mark. Let me turn this off. I'm so sorry. Can we? Let me.
You want to restart?
Yeah, let's do that. Yeah, let me do something so hopefully the phone won't ring. Apologies.
No worries.
I don't know if I can set it on mute or not, but that shouldn't happen very often, hopefully. All right.
The tricks I use is I take it off the cradle.
Yeah, I think I'm going to try that. Hopefully we won't hear anything from that, but yes. All right, so sorry about that. Well, Mark, thanks very much for inviting us to get acquainted today. We're really pleased to have the opportunity to work with your organization. We think that what you do is extraordinarily important. Very quickly, I'm a longtime entrepreneur. Several years ago, a friend and I decided we wanted to do something to make a difference with healthcare in the United States. There are many, many, many problems. For example, there are 28.5 million Americans that have zero health insurance whatsoever. So they're not going to doctors. They're afraid of doing that because they know they can't afford it. Then you have tens of millions of people who, yes, they do have health insurance, but the health insurance they have is such a high deductible or such a high copay that for all intents and purposes, it's really not providing any value to the person that has the insurance. Then you have the issue of convenience. If you need to see a doctor, sometimes it takes days to get in there and so forth. And so we wanted to do something practical to make a difference. And the result, and I know we'll be talking about this and how it would be applicable to your organization, is a program that we've launched called Capstone Health Network. And we'll talk about that in just a moment, what the specifics are and how it could be a benefit.
Well, great. That's a great intro, Jeff. And yes, I think every American can relate to the fact that healthcare in the United States is a challenge. Actually, you and I talked just recently about a Gallup poll that came out.
Yes.
Came out a week ago. It was held the first week in March, and 55% of Americans list healthcare as their primary worry or concern, and it's higher. It's the highest thing they worry about. It surpasses things like immigration and politics and drugs,
Yes.
all those things, which is kind of shocking and kind of underlying how important this particular issue is to both our members and every American. And for everybody listening, it's one of the reasons why we chose to partner with you, because it was extremely eye-opening for me. I knew it was a problem. Personally, I have those same type of concerns that you mentioned, but I knew it might be a problem for our members, but I didn't realize how prominent it was till reading that data from the Gallup poll.
Yes, and realistically, that Gallup poll is not a one-off. For the last 3 years, multiple surveys done by multiple organizations, including Gallup, have continued to show that healthcare is the number one concern of Americans, even above terrorism, job loss, the economy, and everything else. It's a very, very serious issue. And we put together a program to do something practical about it and do it in a way that it's actually affordable for people. So I know we're going to talk now probably about some of the specifics of what's involved with it. But I just want to say to your members that we are very pleased to be a part of supporting what it is that you do. And we put together a special program for you, thanks to Mark and the organization.
Well, let's get right into it, actually. Let's talk a little bit about what the program and what's unique about it. There's a word that we're going to talk about that is relatively new, this telemedicine concept. So let's get into it a little bit and talk about what that is, because interestingly enough, after our initial conversation some weeks ago, Jeff, I happen to be up in New England for some issues with our family, and asked, do you know what telemedicine is? And it was a very interesting conversation with a large group of our family members. Some did, some didn't, and it evolved into a great conversation once I explained what this program was about, and hopefully turns into some inquiries on your end. But let's talk about it a little bit. What is this program? What is its uniqueness?
Well, Mark, when you think about it, in addition to all the other challenges, the affordability of healthcare, the high deductibles, on and on and on, one thing that doesn't get talked about a lot, in an age that we have all this modern technology, healthcare in America is being delivered pretty much like it was 1950. If you need to talk to a doctor and you don't have something that's life-threatening, so you call up your doctor's office, you're put on hold, you're listening to the elevator music, eventually someone picks up. You tell them what you're experiencing, you don't feel well, you'd really like to get in to see a physician as soon as possible, and they tell you that the next opening is 2 or 3 days in the future. So now you're feeling terrible for a couple extra days. You finally get in there, you're sitting in a room full of sick people, you're waiting, you're reading old magazines, you finally get called back, you're excited, you're about to see the doctor, you have to wait another 15 minutes because the doctor's talking to somebody else. And when the physician comes in to see you, probably for 5 or 10 minutes, they finally hand you a prescription and you can start feeling better. That's a pretty outdated process. So what has happened over the last 10 years, there's been the development of new modern technologies, one of which is something that's sometimes referred to as telemedicine, sometimes it's referred to as telehealth. But basically it's this. Members of your organization will be able to speak to a board-certified US-based physician 24 hours a day, 365 days a year. It doesn't matter if it's 3 in the morning, it doesn't matter if it's Christmas Day, it's a Sunday afternoon. They'll have a doctor at their beck and call. Typically, they'll be able to speak to that physician by phone or by a video chat within 30 minutes. And in our particular case, there are no doctor fees whatsoever, there are no deductibles, and there are no copays whatsoever either. So the Capstone program actually has 3 component parts. One is telemedicine. Telemedicine is approved by all 50 states. It's endorsed by the American Medical Association. It's been written about in the Wall Street Journal and Time Magazine. It's very well known in the field of healthcare, but the average person has never heard of it. And in part, it's because the telemedicine companies like to work with organizations and large companies that will sign up their 500 or 1,000 employees at a time. It's never been made available, to the best of my knowledge, directly to the consumer, and nor has it been available to small companies as well. So in our case, we are making a three-part program available to your members. The first component piece is telemedicine. You're able to speak to a US-based board-certified doctor who's able to actually prescribe, as long as it's not narcotics, 24 hours a day, 365, anytime that you need it, without any doctor bills, etc. The second component element is similar. It's a 24/7, 365 behavioral healthcare program, think therapist. So there are huge numbers of Americans who may be going through anxiety or stress or a job loss, or they just lost a loved one. They have any number of issues, and it would be helpful and beneficial for them to go ahead and speak to a counselor. But most of us can't afford $80 to $100 to $200 an hour to speak to a counselor, and most healthcare programs that are out there do not cover it, so people are not getting assistance. So second element of our program that we're making available to the Academy members is telecounseling. The third element of the Capstone Health Network program is a little bit more difficult to describe. I'm not going to spend a lot of time on it, but it basically will give your Academy members their own personal healthcare advocate. So let's say that you need a physician because your physician is retired. Where do you look? Or you want to see if you can get a better price on an expensive medication. You don't know where to look. Or maybe a member has experienced a serious health problem. They had to be in a hospital for X number of days, and they got socked with a bill for tens of thousands of dollars. They're afraid they're going to have to go bankrupt trying to pay it. We have people that will negotiate with hospitals and doctors. They know how to do it, to bring down the high cost of expensive medical bills. And there's a variety of other kinds of services that the healthcare advocates can perform. But those three elements combined, telemedicine, telecounseling, and a patient advocate, we are making available to the Academy as Capstone Health Network. And the important thing is, we are, in addition to being a regular for-profit company, we are deeply concerned with doing things to help other people. So we have purposely chosen to make the cost of this program as affordable as possible. So the actual cost to your members will be, for an individual, $12.95 per month. Or if it's a company that's providing it for its employees, it can be $12.95 per month. And for a family, and the family is deemed to be the person who signs up for the program, the member themselves, their spouse or significant other, and their dependent children, 26 of age and under, and that price is a very affordable $18.95 a month. So I'm going to stop there. I know you'll have some questions, and then I want to talk about who can benefit or what type of applicability it might be for your members.
Sure. Well, you touched on a couple of things that are near and dear to my heart, and one of the things, I'll start from the bottom and work my way up, the healthcare advocate. So my wife has been through multiple surgeries for a problem with her jaw. She's been through actually 7 surgeries. And we moved from Miami up to Jacksonville to Tallahassee, and each of those moves required a change in doctors and all sorts of things. And then you couple with that, there was some problems with some of the surgeries and or change in insurance. So what doctor was covered, what doctor wasn't covered. I can tell you that that element alone, healthcare advocate, is well worth the price from our experience, let alone, the costs for multiple doctors that she had to see with regard to the after effects and all that, other than just the surgeons that performed it. So to me, that resonates. The other thing, Go ahead. I'm sorry, Jeff.
I apologize. I was just going to say that if your members, when they go to check out our website, now we built a special website for National Marine Law Enforcement Academy, but in addition to that, where there's a summary of the benefits, if people go to our national website, which is capstonehealthnetwork.com, there's a big section on testimonials, and there are quite a few examples in there where we've helped save people thousands, some cases tens of thousands of dollars, because the healthcare advocates know what a hospital is and isn't willing to do. They know how to speak to them. They have a lot of success in those areas. So I would encourage your people to take a look at some of those testimonials as well.
Yeah, that's a great point. The other area that's near and dear to my heart is the behavioral aspect. We, relative to right here in Tallahassee, we had a church member whose son had some very compelling issues, and I think that if he had this type of resource readily available 365 days a year, 24 hours a day, that might have contributed and changed some of the outcomes that they had to go through as a family. So I think that's a critical thing. And of course, all the things that are going on all around us, as we see on the news every night, where behavioral health is a challenge. I think this is a core issue that is very, very relevant to our members.
Yes, and I should add, once again, these are all U.S.-based master's level counselors. The only thing is, because we do not charge for those consultations, it's part of the program. These are 30-minute counseling sessions instead of the traditional 50. But on the other hand, there is no charge for them, versus if someone goes to a standard therapist, they may get hit $120, $150 an hour. Again, Mark, in addition to being a standard company, because of our social good underpinnings, we know that probably we could charge considerably more for this program. But one of our core missions is to really help people who are not seeing doctors, or there's moms out there, for example, they know that they have a sick child, but they're going to have to take a half day off work to take that child to the doctor. And so they don't, or they can't afford it because they don't have insurance, and so they don't do it. And you know, it kind of breaks your heart. And the same thing, especially as you pointed out, and I agree with you, even though people tend to focus with our program on the ability to have their own access to a doctor 24/7, but the behavioral health really is a very important piece as well. I should add, so that your members understand the program, they do not have to change their doctor, nor do they have to change their health network at all to use this program. They can use the program if they don't have insurance, and they can use it if they currently have insurance, because we're focusing on the piece of healthcare that is not covered by traditional health insurance, the out-of-pocket piece, the high deductibles, et cetera. So in many cases, I know you and I were just talking, even if someone is getting health care through work, the odds are very high that their employer, in order to keep their costs down, has elected a health insurance plan that has a very high deductible. And so if someone, for example, here in Ohio, where I'm located, many of the programs that are sold with health insurance have deductibles of $6,000 and above. So unless somebody's had something catastrophic happen healthcare wise in a given year, the reality is, you know, they're not receiving any benefit from it whatsoever. You know, let me give you just a personal example, as you were talking about your family. About a month ago or so, I wasn't feeling well. It was a Saturday afternoon. I had had some sinus challenges for a couple days beforehand. So I called in using our program, and in real life, here's exactly what happened. Within about 30 seconds, I was talking to a customer support intake person, and they asked me, you know, what state I was in, because they, our program by law, we cover all 50 states. And the person who's in Seattle, Washington has to be treated by a Washington-based doctor versus someone in Florida. has to be treated by a doctor who's licensed in Florida, et cetera.
Right.
So I was asked what state I was in. I was asked what my healthcare concern was, and I was asked for my home pharmacy and if I had any type of allergies, et cetera. And they told me that they would have a physician call within 2 hours. We normally say an hour, but literally about 4 or 5 minutes later, the phone rang. Turns out that it was the doctor. He already knew many of the things that I had told to the intake person. And by the way, these are all HIPAA compliant conversations and video chats, and we even make available if someone wants to do it an electronic health record and the like. But the doctor asked some very good and penetrating questions, rechecked about if I had any allergies, and basically said, yeah, Jeff, it sounds like you're experiencing a sinus infection, and so I'm going to send over an antibiotic. Are you still with Giant Eagle Pharmacy, which happened to be my home pharmacy? And I said, yes, I was. And I said, well, gee, doctor, I'm not feeling all that well. When do you think you can send the prescription over? He said, I already did it. Now, if I hadn't had my program, there was a really excellent example. Your members can actually see a link to a story that ABC News did. Diane Sawyer ran a feature story on telemedicine, and she gave this quick example, and I'll give the discussion back to you. There was a gentleman that they interviewed who was working in his yard, and he was pretty sure that he had encountered poison ivy. Normally what would have happened is he would have had to go to an urgent care. It was a weekend, so his situation wouldn't have been particularly critical. So he would have been sitting around for, who knows, half hour, 45 minutes, while other people with broken legs and so forth got treated. Eventually, he would get in to see a physician. The physician would look at his arm and say, yeah, looks like you've got poison ivy, here's a prescription. Well, he would have probably wasted 2 or 3 hours of his weekend, and that individual would be thinking to themselves, well, it was a pain in the neck to have to give up all this time, but at least I got some medication for the itching. Gee, I've got insurance, so I don't have to worry about it. It's going to be covered. Well, 30 days later, they get a bill for $100 from the urgent care because that individual would not have gotten anywhere near covering his deductible. So he's going to get stuck with the entire bill. Well, in the ABC News interview, what actually did happen was a person called up, spoke to a telemedicine doctor very quickly, did a video chat, showed the physician his arm. The physician said, yeah, you probably have poison ivy. Where do you want me to send the prescription? So he never had to leave home, didn't have to waste hours of time, ended up getting the same prescription that he would have gotten, and there was no $100 fee for the urgent care. And so there's so many benefits. I was going to ask you something. How much do your members actually travel? Because that's another benefit of this program.
Oh, that's a good question. So most of our members in maritime law enforcement, emergency response, or public safety are public employees, public sector employees. So they work at either the local or municipal level, the county level, the state level, and then of course there's some that work at the federal level. So in their jobs per se, they might not travel that much, but actually academy folks, our cadre of instructors, travel a lot. That's what we do as an academy with no walls. We deliver exportable training. We go all over the country to train officers on their maritime platforms, their boats, in their areas of operation. So to them, they travel a lot.
Well, this program, to the extent that any of your members travel, either for work or just personal, would be ideal. It could be that the member wants to take their family to Disney World or something.
Right.
Wherever they're located, it doesn't matter. This is 24/7, 365, as long as it's in the United States. And they would be able to speak to a doctor that's licensed in whatever state that they're currently in, so that the doctor is able to, in fact, prescribe. I do want to say one thing. I should have said this earlier because I want to make sure that the members of the Academy really understand where we can help and where we can't. The one downside of telemedicine is that it's not for something that's life-threatening. It's not for broken bones, obviously, etc. But there have been studies done by a variety of different reputable organizations. And Mark, if you think about it, and if the people listening to this podcast think about it, the vast majority of reasons that people see doctors, it's not because they're having a life-threatening issue, or that, God forbid, that maybe they're dealing with cancer or something. Most of us see doctors for much more mundane reasons. Gee, I've got a cold, I've got a flu, I've got a sore throat, I've got an earache, I've got pink eye, I've got a sinus infection, I have a skin rash, I'm nauseous, I have a question I want to ask a physician, etc. And those kind of medical issues are absolutely perfect for telemedicine. And again, of course, we also have the other services as well. So this will be able to cover approximately 80% of the reasons that people see physicians. So why that's important is, even if your members do in fact have insurance, some of them may be paying for it themselves, and they surely want to minimize their out-of-pocket cost. But in other cases, even if they're getting insurance through work, it's probably insurance with relatively high deductibles and copays. And our program for 80% of the issues is going to eliminate that. And most health insurance has very limited coverage, if any coverage at all, for consulting or counseling rather. And once again, there are real people out there with real problems that are afraid to go to a doctor because they know they can't afford it. You know, what prompted me to get into this, candidly, was I saw a front page story in the New York Times a couple of years ago about a health fair that was conducted somewhere, it might have been Appalachia or something, but they offered free medical care. The doctors volunteered their time, and 3,000 to 4,000 people showed up. Some of them camped out overnight at this fairgrounds just to finally have the opportunity to talk to a physician. And in a wonderful country like ours, that should never happen. Okay. So, you know, we can't solve everybody's problem, but we want to do something to help. And we believe that the program we put together and at the price point that we've chosen to make it available is going to make a difference to the health and well-being of a lot of your members.
I couldn't agree more. And I want to go back to one thing you said when you talked about who or what is the most likely occurrence where someone is seeking to see a doctor. It's not those life-threatening things, of course, but it's I'll call it the mundane. You know, it's an ailment, it's an ache, and you just want to validate what you think it is. But the point that I wanted to make is, I think I am the prototypical male in that if there's something aching me or bothering me, my wife is constantly prodding me saying, hey, I think you should go to the doctor to have that looked at. And I'm constantly countering and disagreeing and saying, and I'm being totally truthful. I'm not just saying this for the purpose of this podcast or because I'm talking to you. But in my head, I'm like, I don't want to waste half the day to go there for them to tell me, to use your example, I've got a sinus infection. I'll just deal with it. In absolute worst case, if I have to go get some sort of antibiotic, okay, then I'll do it. Now, we can both see the problem in that logic. And I'm not saying it's the smartest move that I make, but I think we all as men, we have this tendency to look at all the reasons why we shouldn't do it. And with this type of resource, well, now I have really no objection. I really can't logically or reasonably counter the fact that I can pick up the phone, I can talk to a doctor, and I can either validate what I think is wrong with me or have a doctor saying, no, Mark, you really need to go see, your physician because this is a little bit, or could possibly be something a little bit more than what you think it is.
Yeah, when I called in for my own treatment, I didn't tell the physician who I was. And at the end of that discussion, I was very impressed. I also got an email saying, thank you for using the program. And, if you have any other follow-up issues, let us know. Everybody that signs up for the program will have their own membership card. And again, if they buy the family plan, which is $18.95, it'll cover their spouse and their dependent children up to 26. But I asked the doctor who treated me, I said, how often can you really diagnose and treat? Are there ever situations where, someone who calls in, you can't help? And he said, oh, yeah. He said, I talked to somebody the other day, and based on the symptoms that I was able to elicit from that person, I told him, I thought you're having an appendicitis attack. You need to get to an ER right away. And he said, occasionally I'll talk to somebody, and based on the symptoms, I'm telling them that, you know what, I think there's a very good likelihood you're in the early stages of having a heart attack. You need to be able to go to an ER right now. But he said, the vast majority of cases, in his case, he said 85, 90%, they're able to solve. And every time they do that, that eliminates a copay, that eliminates a deductible, and it certainly gives people back a lot of time. I like to say that if one of your members uses this program once a year, it'll probably pay for itself on the healthcare side. If they use it, for example, for counseling, given what counseling sessions cost, they may be able to pay for an entire year of this program once again from one counseling session. It's unfortunate and very, very frustrating that the good folks in Washington spend so much time arguing about healthcare. But while they're busy arguing, there are real people who are suffering. They're not getting the healthcare they need. They're not being able to bring their kids to a doctor. I mean, these are real people with real problems, and we just wanted to do something to make a difference in this. And so by pulling together some of these more innovative healthcare strategies that are absolutely well respected and they work, we think that we can make a big difference in the quality of life and certainly the health of many of your members.
I totally agree. And I think obviously we wouldn't be doing it if I didn't have faith in it and feel like it was a direct impact on the people that we're here to serve. So I totally agree with you. So in bringing this in for a landing, Jeff, I have one question, and maybe you can answer it, maybe you can't. Actually, if you probably can answer it, you'll be a lot more wealthier than I, because you can look into the future. But what do you see the future looking like, given where we are right now, given the solution that you've developed, which I applaud you for. It's tremendously innovative. But what do you see? What's your crystal ball look like?
Well, there is a significant shortage of physicians in the United States right now. And so there's a couple of trends. Trend number one is to automate everything that people possibly can. There's ways that people can be treated, through the internet, for example, at an accident site, for example, remotely, where they can speak to a hospital or a doctor, et cetera. So there's a lot of technology innovations that are out there. But we think that one of the emerging areas will be, I heard an interview with a senior official at the Cleveland Clinic, which is one of the top hospitals in the United States. And they said, this individual, that they felt that 5 or 10 years from now, that half of the revenue of the Cleveland Clinic would actually come from remote or telemedicine related services, because it's very expensive for a hospital to have hospital rooms and tie up time and so forth for things that really aren't health critical. And so we really think that the healthcare community is moving in a direction of telemedicine. It's just that the predictions are that's 5 or 10 years into the future. There's probably 10, 15 million Americans that have some form of telemedicine now because they work at a huge company. Well, that's fine, but what if you don't work at a huge company? Or, in some cases, telemedicine is included in a Blue Cross plan or something, but it's one of 50 different offerings in that solution. And a lot of times they'll charge $40 or $50 to talk to a doctor, which to me defeats one of the primary reasons of having telemedicine. So, obviously I'm a little bit prejudiced about this, but why not take advantage of new technology and being able to speak to a doctor in a way that saves money, is a whole lot more convenient, and could cover more people. And if someone right now, let's say one of your members, they have a $1,500 health insurance policy, and their employer is covering $750 of that. Well, that's still almost $10,000 a year.
Mm-hmm.
And, you know, the vast majority of times they need a doctor or they need to get a new prescription or whatever it is, it's not being covered.
Right.
And so in this particular case, even if they have insurance for an additional $12.95 a month, it'll go ahead and provide all kinds of benefits in some other areas like the counseling services as well. So we're excited to be on the forefront. And again, I just really want to thank you for your forward looking nature and also your commitment to provide more and more value for the members of the Academy. We are absolutely thrilled to be partnering with you.
Well, we are very excited as well. I think this is something that shows an immediate benefit to our members. For those listening, again, let me give you the website to go to, capstonehealthnetwork.com #NMLEA. If you go there, there's a landing page there that'll tell you more about the program. You can go to the core website that Jeff alluded to, capstonehealthnetwork.com, to get the testimonials and learn more about the program there. When you do register, we encourage you to use our code NMLEA when you sign up. And with that said, Jeff, I just want to thank you for taking the time. I know you're a busy guy. This is a big chunk of your day. But I think it's very informative, and I think our members will learn a lot from it, and I thank you for taking the time.
Mark, thank you so much. We're thrilled to be working with you in the organization.
Thank you, sir. Have a great day.
You as well.